Good evening, everyone. I can't see who that is. It just, we got some people checking in, but good evening, everyone. Welcome to the webinar tonight. Today, we're going to be talking about the Heart Sound Recorder. The Heart Sound Recorder is a device that actually helps to evaluate the heart in a way using seismographs and gives us way better energy than any kind of stethoscope could ever do. Lynn is an RN, Lynn Nanicola. She is an RN. She's also a nutrition response testing practitioner, which is pretty much what I do here when I'm testing people for supplements. So anyways, I'm going to let Lynn go a little bit about yourself and tell people who you are so that they know who you are. And this is who you'll get to see when you come in to do the testing. So Lynn, I'll leave it to you.
Awesome. Thanks, Dr. Sobczak, and thanks for that introduction. So as Dr. Sobczak spoke, my name is Lynn Nanicola. I am a licensed registered nurse, and historically, I had the opportunity to work at the cardiac step-down unit at the Cleveland Clinic. So I'd like to think I've kind of come this full circle into this natural medicine, especially through the journey of raising my own children, and I've had the privilege of working with standard process supplements for 20 years. So very fortunate that way. And I do nutrition response testing, as well as I work with Standard Process of Ohio now, going out and providing the service of the Heart Sound Recorder. So we're going to get into that more detailed this evening. So I think we can certainly get started, and thank you so much for inviting me, and welcome everyone.
So just so you guys know, I think this is a great, you can go ahead and get the program up and running, but I just think
Sure.
that I really wanted you guys to be able to see why we have this service in our office. It's just so important to be able to not have to wait for symptoms to occur before you find out there's an issue. So that's why I invited Lynn, and so I'm going to let her take it the rest of the way from here for a while. I'll still be here, but it's all you.
Absolutely. Sounds great. Thank you so much. So here we go. Let's take a look. As you saw on my initial screen, I was referring to humble beginnings and revolutionary results. And I see that with this original endocardiograph that Dr. Royal Lee invented as a very humble beginning. And yet now we have this beautiful Heart Sound Recorder that has obviously been brought into the 21st century. And it's a tool that we're using in clinics. And again, very, very welcomed in Dr. Sobczak's office. And his clients are responding quite well to the graphings and to the nutritional protocols that we are putting together. So we're not only providing support for the heart, but we're also looking at adrenal status, digestion, fat metabolism, how that pulmonary system is working. So we're getting a lot more information when we use our Heart Sound Recorder. So we're able to provide this tangible, visible, kind of objective window, if you will, of information regarding the status of the heart, as well as the overall status of the body. So I hope that you find that the information that I'm providing here tonight, you'll see that this is a real vital service, and it's really transformative to people's optimal health. So a brief introduction and some of the history and the importance of Dr. Royal Lee's endocardiograph, which now, like I said, is the Heart Sound Recorder. I want to explore why and what led Dr. Lee to the invention of the endocardiograph and why it's so important in today's practice. So just a brief information. Of course, this webinar should not be constructed as a claim or representation that any procedure or product mentioned constitutes specific care or remedy for any condition. The intent here is to support normal physiological and biochemical processes of the body. So with that being said, let's move on. What led Dr. Royal Lee to the invention of the endocardiograph? And I must say, for those of you who aren't familiar with who he is, he was the founder of Standard Process Supplement Company. So in 1929, this was his baby. So we have, and still do, the privilege of having over 600 acres of organic farming in a small farm town in Wisconsin, Palmyra, where the manufacturing facility is less than a mile away. So all of these wonderful, wonderful beets and Swiss chard and Spanish black radish are extracted and bottled and then distributed to healthcare professionals, and you will find them in offices throughout the country. So we're very privileged to have that still in play. So the endocardiograph was actually started 8 years after he started Standard Process. The man was a genius of himself. This wasn't many years after the introduction of what is known as the foods of commerce. Sugar consumption and highly refined carbohydrate foods were quickly on the rise, and the bleaching of white flour was becoming more popular than ever. And by the way, the bleaching of flour started in 1906. So Dr. Harvey Wiley was the first head of the FDA, which was then called the Bureau of Chemistry. He tried to stop bleaching flour, knowing the toxic effects of the bleaching process. He even banned the interstate commerce of bleached flour, and Dr. Wiley was ultimately fired from this position because of his commitment to do the right thing. So bleached flour, using these bleaching agents, commonly known as benzoyl peroxide and chlorine gas, among other toxic substances, speed up the flour's aging process, and of course, allows for it to be stored for longer periods of time. So of course, this looked more attractive to larger consumer commercial food companies. Bleaching destroys naturally occurring B vitamins, which we're going to get into quite depth tonight, and also converts the vitamin E fraction into a toxic substance called alexin. And that destroys the beta cells of the pancreas, which can ultimately lead to things like diabetes. So if you want to learn a little bit more about this, I suggest you go to a website, SalineRiverPress.com, and we can send you that link at the end of the webinar. So here are a few substantial references regarding bleached flour. The first one is from the Supreme Court, and it states that in 1910, bleached white flour was declared unfit for human food by the Federal Western District Court of Missouri. The second one from Nature is very respected British journal. It reported that bleached flour is so poisonous, it causes a disease in dogs known as running fits, and was shown to be an exclusive disease to the bleached chemicals in flour. The third, published in the Science, reported that vitamins are destroyed by bleaching of flour. When cattle eat grain without these vitamins, they would show no harmful effects until they suddenly drop dead. It goes to say that heart disease is rare in China, where bleached flour is also rare. So this is more of a current publication from the Lancet. You may have heard of this. In the 1900s, we know that the leading cause of death in the United States was pneumonia. Well, by 1930, heart disease became the #1 cause of death in the United States. So it seems reasonable that this was in a big part due to the bleaching of white flour. If you have ever read or heard of Dr. Roy Lee talk about bleached flour, he has considered it one of the worst tragedies for human consumption. So again, he invented the endocardiograph in 1937, which seems very timely with what was happening to our food supply. So here, again, this is a very updated article, 2017, and the ultimate findings support that studies indicate a strong association between refined grain intake and cardiovascular disease risk. So it's not so much from total fat or fat associated, but more about those refined carbs. So this I found very interesting and thought I would just add it. So the average person in the 1700s ate 4 pounds of sugar a year. In the 1800s, it was 18 pounds per year. And by 1900, it was 60. So today, 25% of us consume over ½ pound of added sugar daily, up to 180 pounds per year. This is why 1 in 4 Americans is either pre-diabetic or has type 2 diabetes. So let's get a little bit more into the heart sound recorder itself and what it does. So let's understand that your heart is the most important muscle in the body. I think most of us can agree upon that. Some stats: every day it beats 100,000 times, sending 2,000 gallons of blood through 60,000 miles of blood vessels. It's incredible. So it's also the first muscle that responds to nutrition. To function optimally, it is vital that the heart have the proper nutrients to maintain its correct rate, rhythm, and tone. And we're going to get more into that as the webinar goes on. So remember those words: rate, rhythm, and tone. And I remember the first time that I read these statements and the first time that I truly understood them, and knowing the impact that heart health has on the person's overall health, as well as looking at the fact that the heart holds valuable information, that by looking at these graphs, we are able to support other systems in the body. So I really felt called to continue working with this heart sound recorder and working with patients so that I could provide any age, no matter what their condition, that I could really value this information and offer them life-changing knowledge to support their whole being. So this is kind of an interesting, a growing epidemic. We see in 2007, we know 125 young athletes died from enlarged heart. So most of us have heard of a case where a young athlete suddenly dies while playing their favorite sport, and this is very tragic. Of course, I do know that there are high schools who are now offering EKGs because they're becoming more aware of this problem, and this is good. However, EKGs, they have their limitations as well, as they show us the electrical function and the trauma that has already occurred in the heart. But what if we had a device that could visibly show us the valvular movement and the muscular function of the heart? And so we do, and of course, Dr. Royal Lee created it. So the heart sound recorder provides us this specific information so that we can prevent these future concerns. So understand something: with an enlarged heart, the heart being a muscle, it is able to expand, but the valves, being connective tissue or cartilage-like, do not expand. So therefore, when the heart muscle squeezes and pumps blood forward, some of this blood can leak backward through the valve. So most people aren't going to have any symptoms, especially in these initial phases. But however, these can turn into very serious complications like arrhythmias and of course AFib. And so we can recognize these type of things on the heart sound recorder, providing nutrition. So we need to start really thinking about prevention and using this as a tool for prevention instead of waiting to see what kind of damage has been done. So again, today, heart disease still remains the #1 cause of death for both men and women in the United States. So let's get into, what is this endocardiograph that I'm talking about? What does the heart sound recorder look like? So take a look at the top picture. It certainly looks very classic. You'll see the microphone sitting there on top that Dr. Royal Lee himself patented. And of course, the paper strips. So the graphs were obviously printed off on these strips, and which took, a lot of paper over time. So the great and robust engineers who created the current updated heart sound recorder certainly knew that they wanted to make this a more digital format. They wanted to make it the software user friendly so that we were able to actually store this information on our computers so that we're able to compare these graphs. When I graph an individual, say today, another 4 weeks, they may come back and see me, and I am able to compare those graphs. So it's a wonderful, wonderful advancement that we've come to. And obviously, some of the more physical features, the original endocardiograph was about 40 pounds and my little device is about 1.5 pounds. So, and graphing these 4 different valves takes us about 5 minutes. And I can graph from patient visit 1 to 1,000. So we have plenty of space in our software to do.
Just jump in 1 second and just say that it's interesting because the heart sound recorder, they had a really hard time. I mean, it took like over 20 years to try to figure out what Dr. Royal Lee actually did. And when they finally figured out that the microphone he was using was more of a seismograph, I believe, is what I remember hearing is that then the heart sound recorder was able to be developed the rest of the way. They tried for years and years and years and just could never figure out how to do it. And so it's just been within like the last 5 to 10 years that they actually figured out how to get that thing working. So. And it's amazing. It's a seismograph. It's actually not a microphone in the new one. So it's pretty cool.
Yeah, that's absolutely right, Dr. Sobchak. So it's very similar to that of a seismometer, which is that listens to the ground. So it listens to motion, like a seismometer listens to the motion of earthquakes. So this particular device listens to the motion of the heart, so that the circulation of the blood, the valve closures, that muscular function. So that's absolutely right. And that's one of the biggest features. That's what was patented. And yeah, it took, again, I know 4 specific engineers to really put all their minds together to create this. And so it's really cool if you go into all that science, but yeah, thank you for sharing that. So again, we have this 21st century technology, the heart sound recorder, and it's the progeny of science that was invented in the 1930s. So I absolutely love that. I want to take a look and compare the idea of using a stethoscope to the heart sound recorder. So a stethoscope, obviously, you know, it's used in practice and it's beneficial for an observation for a moment in time. It was invented in the 1800s, basically because the doctors didn't want to put their ear on a woman's chest. So that's how it began, but it certainly, top physicians are questioning its efficacy and if it's going to be continued and used for diagnostic purposes. For starters, the result of listening to the heart, the lung, and the bowel sounds, the limitations of that is dependent upon the practitioner's ear and certainly how they were trained. So as a nurse working in the cardiac step-down unit, I saw this daily, you know, from shift to shift. We would certainly see that different nurses heard different sounds based on their hearing and based on their clinical experience. And we were certainly all trained by some of the best cardiac doctors around. So we don't have those issues here. We have the ability to store these graphs. We can record them and we can save our information to pull up at a later date. So I thought this was kind of a cool graph, the relationship between the range of sounds produced in the heart and the threshold of audibility of the human ear. So as you can see here, here's where our heart sounds and murmurs. We have a sound intensity and a frequency. And here's where our threshold of audibility and audible cardiovascular sounds lie. And here is the speech area. So right in here with this dark gray area is what we're actually can hear. So we're missing a whole abundance of heart sounds and murmurs if we're simply auscultating. So again, the HSR, it's very unique as it captures only the sounds made by the heart without the interference of other sounds in the body. So that's a great feature in terms of what we are offering, you know, to the patient with this service. So let's take a look at some of the principles of the heart sound recorder. So what does it do? It monitors certain types of heart stress by recording the rate, the rhythm, and the tone of the heart cycle. We are able to assist providers in observing the heart's reactions, whether it's having a chemical reaction some kind of reaction to a nutritional deficiency or an emotional stressor. So I certainly can get into, patients' history, what they're experiencing. Maybe they just had something tragic happen in their family. And certainly these things can be found by the graphing that they see. So there's all kinds of support that we can offer them based on this heart sound recorder. We're also looking at the stimuli, vitamins, sugar, caffeine, alcohol. These types of things certainly change the frequency, the ratio, and the amplitude of the heart forms. And we're going to look a little bit later at some graphs, so you'll be able to see exactly what I'm talking about. Again, we can compare these graphs. So it's really neat for patient compliance, because they can come in and see these changes. And not only are they feeling better, but they're seeing changes on their graph, and it just keeps them more motivated and to continue on with the process. So I love the quote by George Goodheart, who said that the heart is the best proxy of nutrition status of the entire body. It receives the complete blood supply every minute and gets first choice of what is available. So I've come to learn that that's so very true. And it's certainly true in Dr. Sobczak's office, where patients are undoubtedly supported by nutrition programs. And I'm there.
There you go.
Here we go. We're back.
Back.
My sincere apologies. So the internet,
Wi-Fi outage, huh?
yeah, went down. So thanks everybody for your patience. So it just
Had to bring the IT technician in, huh?
yeah, definitely. Multiple.
Thanks,
They're the
daughter.
You're welcome.
She's amazing. This is Maya.
Hello.
So again, this is certainly so true. And knowing that we can change graphs within 10 minutes of offering patients, for example, Cataplex B Core, I certainly agree with Dr. Royally in his position. So, the heart sound recorder is a low risk general wellness cardiac stress monitor with a specialized microphone. We were just talking about that. So similar to that of a seismograph, which listens to earthquakes. So it's strategically positioned to hear and record the sounds of the 4 heart valves. So let's get into what the heart sound recorder in action looks like. So here's, for example, the screen of my computer when we're graphing a patient. We're adding the patient's information, their age. I'm offering them a pulse ox. I want to see what the oxygen carrying capacity is in the blood. I want to see an initial heart rate. I'm also verifying that when I'm graphing them. We are certainly discussing their nutritional programs, any medications that they may be taking. We're talking about what they're experiencing, why they came in today, if they have cardiac concerns, or this is just a wellness look into this particular, window to continue moving them in a great direction. So once we have completed the graphing of all 4 valves, which takes us about 5 minutes, and our total session is about 15 minutes, I offer nutritional recommendations, maybe lifestyle changes, depending upon what's going on. In preparing for this test, we ask them not to eat 2 hours prior to the exam, try not to take in any caffeine. Sometimes I actually use caffeine as a stimulant if I suspect that possibly it's negatively affecting their heart, because it is a real game changer when they see the impact that it's having on the rhythm of their heart or the rate of their heart. So other than that, as you can see in the picture, I ask that they dress comfortably, one fine layer, so a t-shirt is perfect, or the ability, to get to that point.
And it really hurts to put that on, doesn't it?
Yeah, not so much. With strategically positioning, that's for sure. So that's probably what takes the longest, is just making sure this is positioned properly where we're going to get a nice picture. So we're looking to place this on 4 different places, and I'll get into that in just a second. Here we go. We're looking at these 4 different places on the chest where we have the mitral, the tricuspid, so the lower chambers of the heart, and then we go up to the aortic and the pulmonary, so the upper chambers of the heart. And patients often wonder, is this actually where these valves are truly positioned? So no, they are more centrally located in the heart, in the chest area. However, this is more where the blood movement is optimal. So this is why we choose these locations and what's best for ultimately the graphing. So autonomic nervous system controls the rate at which the heart beats. So certainly we know that there's 2 sides to that autonomic nervous system. There's the sympathetic side and there's the parasympathetic side. So that sympathetic side is kind of like the accelerator in the car. It keeps you going, it gets you up in the morning, keeps you going all day. It's that fight or flight response. You may have heard of that. The second side is that parasympathetic system that hopefully engages in the evening. So it's like the brakes of the car. It helps us rest, helps us digest. So these are some different functions that our autonomic nervous system is responsible for, certainly influenced by diet and vitamins and other factors. So, all us muscle testers out there, or those who may have a heart rate variability device, those are awesome at, checking out that autonomic nervous system. Is this person in a sympathetic mode? Do we need to support their parasympathetic system by possibly using some alkaline ash minerals? Maybe they've just ingested this high carbohydrate, high sugar diet, and we know that potassium follows that sugar. So they need some minerals to kind of calm this system down, calm this heart down. So we can certainly support them if we see that their autonomic system is imbalanced. Looking at the rhythm of the heart. So this is one of those where patients are looking at my screen and saying, wow, something just doesn't look right, This is the lub-dub of the heart, which is a very specific, what we call a work to rest ratio. So we like to see that the heart is resting twice as long as it's working. So, and it's very obvious to patients if this is not the case. So if the heart is working so hard and it's like double time, that's often how the patient feels as well. Or if they have a really long rest ratio, they probably aren't really able to get up in the morning and get themselves going. It's kind of like they feel like the brakes are on all day. So how do we support this individual? Well, we have definitely the best nutrients out there, and putting together a combination that will support them so that we can slowly move this rhythm back into its correct ways. So Cataplex B, specifically, I love our new Cataplex B Core supplement. I'm not sure if you use it often, Dr. Sobczak, but
We're starting to use it a lot more.
Yeah, I mean, it's a game changer, really. It's not so much that it's new to standard process, because certainly it has all those yummy ingredients that we're accustomed to, like liver, nutritional yeast, beets, sweet potato, defatted wheat germ. So it's really about just the synergy and the concentration of those particular products that's providing those B vitamins. So B1, B2, B6, and of course that lesser known one of B4, which is really what Roy Lee was talking about. That B4 you cannot get from a synthetic vitamin. It promotes that nerve conductivity of the heart, so it helps to maintain that rhythm. So, again, not only are we just looking at be for, B1 thiamine. There's often people show a deficiency of that. They may be showing some kind of cognitive decline or optic nerve ailments. So there's other things that we certainly can get into, especially as I get to know people more. I had an elderly gentleman who was having just that, some issues with an optic nerve that they actually, he was having some smells, some obvious smells that were not normal. So they did a graph and there was a lesion there. So the first thing I thought of was certainly using our Cataplex B and providing him with some whole food nutrition. So at this point, everything is clear. So we're super, super grateful for that.
Hey, let me just say that one of the main reasons that we use Standard Process is because Standard Process is whole food, it's organically grown, and it's cold processed, which means that it's not heated above. So once something is heated over 114 degrees, it starts killing all the nutrients and the cofactors and the enzymes. And so it's heated at like between 80 and 90 degrees, but it's at like 28 atmospheres. So it's at a high pressure, but a low temperature. So it's not killing all the main qualities within the supplements. And so that's one of the big things that I really like about the Standard Process vitamins. If it's something you want to learn a little bit more about, you can go on our website and click on the video area. And I did talk, there's a video down there, I think it's called Can Taking Vitamins Kill You?, where I explain the difference between synthetic vitamins, whole food vitamins, crystalline, and all that kind of stuff. So it's a great way to understand that when you get something from Standard Process, like for example, vitamin C, you're not going to see 1,000 milligrams, because 1,000 milligram of a whole food is going to be like the size of a golf ball, as opposed to something that's a lot small, like for example, the eggshell, which is the synthetic vitamin C, the ascorbic acid. The whole complex would be the whole egg. And so there's just so much more that you miss when you're getting synthetic vitamins. So sorry, go ahead, Lynn.
No, it's such a great point. It's so valid. And it just brings me to, one of the next slides referring to, this high potency B vitamins that we often see, whether they're sold at the grocery store, the vitamin store, Costco, whatever it is. But oftentimes patients are taking these and they are, as you say, they're synthetic, they're made in a lab. So it's a nutraceutical. So it's one step down from a pharmaceutical. And when you're looking at our supplements, you're not necessarily looking at, wow, there's nothing in here really, is what patients would say, but we've got to look at the ingredients. So again, things like bovine liver, organic beetroot, nutritional yeast, who's eating those things on a daily basis? Our body knows what to do with those, doesn't know what to do with all these B vitamins. We're just basically peeing them out. So, and if you look, not only does our B core have all these great Bs, we have folate too. So those of people who are going to functional medicine doctors and understanding their genetics, and they may possibly come in with the MTHFR genetic defect. So we're not giving them, the synthetic folic acid that the body doesn't know how to convert. We're actually offering them food supply of folate. So, it's exactly a great point to make at this time. So again, let's take a look. The muscular strength of these ventricles and valves, super, super important. So it's the tone of the heart. We can observe this by the height and the width of the two beats made by this heart's what's called a lub-dub sound. So that first sound, or S1, and I'm gonna show you on some graphs what I'm referring to. That lub should be 2 to 3 times higher than our second sound, or our dub. So when our mitral and tricuspid valves close, we know that next we're going to have our blood circulating throughout the body. And as that blood circulates back up and around and the aortic and the pulmonic valves close, we know that the heart is going to rest and refill, and we're preparing for that next cardiac cycle. So we're going to take a look at that in a little bit more detail, but this is a really important part of what I'm analyzing. So when we're supporting muscular strength, indeed with things, Dr. Sobczak, like cardiotrophin, PMG, Cataplex B core. Sometimes we're using Cardio Plus, which has some amazing nutrients in it, along with your Cataplex C. So we're using things that are offering these ventricles and valves what they need to give them some muscle strength. And indeed, the patients feel better all over muscularly, they're stronger. Point here, as you obviously got from, if you read that during the time. So B4, which only comes from food, not the synthetic vitamins, is able to restore tone to the heart muscle. The B4 stops that valve leakage and those regurgitating murmurs of that enlarged heart. So how on point Royal Lee was back at this time in pertaining to the crises and situations that we're dealing with today. So again, looking back at this, Standard Process has never been about, being a label company. We're really about what we're providing inside. And Dr. Sobczak gave an excellent overview of that. So some of the primary ingredients, again, aren't these lovely? I just had to include this. So I don't know anyone who's eating these on a daily basis. I'm sure I may recommend certain nutrients like nutritional yeast. Bragg's offers a nice yellow powder, awesome to add to your popcorn or soup or salad. Certainly, utilizing beets or juicing beets are beneficial. But when we can provide this kind of thing in a supplement that people are able to chew, they do really appreciate that, because a lot of people sincerely say, I'm just not going to be able to eat liver, or they're not able to find a good source. And certainly that's something that I talk about with them as well. So nutritional yeast is one of those two that it's included in like 35 of our Standard Process products, not just because of the bees, but it's also a complete amino acid product. So we use it quite regularly. So
I was just going to say that you said in there, chew the vitamins. And a lot of people would sit there and go, chew them? Why would I chew them? But you have to remember that this is food in another form. And when you chew it, the very first thing that happens is your brain, you taste it. So your brain knows exactly what's coming. And so it can help the body to utilize it at a much higher potential.
Absolutely. I mean, that's the first point of digestion. We get the salivary juices, right? We get that whole process moving. And the old timers, that's how they took all of our supplements, right? They chewed them all, adrenal included. And so, this Cataplex B core that we're going to talk about a little bit more, it is actually a caplet. So it's made to be chewed. And, though it is a little earthy, it tastes more like beet to me. So it has that sweet side to it, and it's very palatable.
I always try to tell people to eat them before you eat your food, because otherwise, if you do it afterwards, you might smell like dog breath.
This is true. This is true. I had a preschool student who came in for an HSR, and during the graph, I offered her a Cataplex B core, based on her graph and knowing her diet wasn't all that great. And she certainly is, overstimulated, as most of our children are today, with everything that they're dealing with. And she actually chewed it and said it wasn't that bad. So I felt pretty validated that day. And the fact that, I think most people can handle this. I think I can chew it.
My son chewed his for a long time because, they really, their body understands that it's good for them. And so they have no problem chewing them up.
Yeah, no, that's so true.
Unless they've been polluted with a lot of sugar, then you got problems.
Well, and true to that, but that's the beauty of using these B-Vites, especially because we know that this converts that glucose into electrical energy, right? So it kind of goes hand in hand with kids, or, people are going on vacation knowing they're not going to be, eating as strict as they usually do, and life's going to be a little different. And so using these for those purposes are great. Or, you're going to be going out a little bit more. Your body's trying to process, the alcohol that you took in the night before. So we know that B vitamins can assist with that too, because they get depleted and the bloodstream is called upon to kind of replenish that supply. So, there's multiple reasons for using it, and yeah, kids are great because they're so straightforward and usually don't have all the layers as adults. So, providing them with some wholesome nutrition, B vitamins, often omega-3s, we can really make wonders happen for them. So I love working with kids. And in terms of, what is the youngest patient that we're able to graph? Hey, as long as they can sit still and during a graph, I can do it. So we don't want a lot of fidgeting, moving head from side to side or up and down. But if they can sit for 15-second intervals, I can graph them and we can support them. So let's take a look at some heart sound recorder graph examples. So I'm going to start out by showing you this is a completely ideal graph, okay? So again, we're looking here at this nice lub-dub, lub-dub, lub-dub rhythm. That is 3 full cardiac cycles. We have our S1 or our lub nice and compact and nice and high. So we're showing nice musculature as well as valve closure. So here is our work to rest ratio, showing our heart is resting twice as long as it's working. Okay, so our first sound is 2 to 3 times higher than our second sound. And this line is nice and straight in between. Again, I see all kinds of variations from here, but this would be a completely ideal rate, rhythm, and tone.
Let me just jump in 1 second. Hey,
Yep.
in the chat box, everyone, first of all, you can ask questions if you want, and I've got the chat box open. The second thing is just let me know that you can see when she's pointing things out with her pointer. Just let me know that you can see that. That's all.
Because I can also annotate if need be.
Yeah, I'm hoping that they can see you moving. I can see it, so I'm assuming that they can. But I just
sure.
Just
sure.
hoping that they can see that. So.
Yeah. No, great question. Thank you for that. Let me know if we have something other than their ability to see. So again, we like to see something similar on all 4 of the valves, and we have this ability to see this just in this way. So let's take a look at, for example, this is something that maybe I see pretty commonly, actually. So if you recall my talking about, we like this nice straight line. Well, what's circled here is kind of this fluttery stuff. Again, lifestyle, stress, lack of B vitamins, high carb diets, too much sugar, all kinds of stuff that we can kind of get into as I get to know this patient and ask them questions. On this particular graph, there's actually a second sound missing. So often there's a variety of reasons for that. One of them may be they do not have enough ionized calcium in their tissues. So it's possible that I'm going to do some type of calcium cuff test. Is it calcium they really need, or is it unsaturated fatty acids to get that calcium delivered? Often I may see that like at the end of the summer, where the sun has actually provided so much vitamin D that it's actually pulled that calcium back into the blood. So we just need to kind of transform things. So it's kind of a great way to see, as you know, other things going on in the body. And this patient may also be feeling things like cramping, something new to them, in their legs or throughout the body, during exercise, they're trying to go to bed, whatever it might be. So again, we've got looking at this S1 here, we've got some dropping off. We're showing that we need some B4. We need that nerve conductivity to get that nice valve closure. So again, we're going to be evaluating each of these graphs and determining the best program for a patient. So again, eventually something could turn to what would look like this. So, and indeed, if a patient came in with a graph of this nature, honestly, they're typically know that they have this type of arrhythmia. Possibly they're working with a cardiologist of some nature, but we can also support them nutritionally. And I have the ability to create PDFs of all of my graphs and email them off if we need to. So we can also work collaboratively for a patient of this nature. Certainly I'm not diagnosing anything, but I'm really using this as a tool so I can get into, you know, the real arts and kind of the science behind how to best support a patient like this. So let's take a look here. Look up at this initial graph. Can you guys all see me with the cursor? So this happens to be a 43-year-old female, and she historically has a diagnosis of an arrhythmia. She has not felt well in quite a long time. So she's missing regularly a nice strong S1, right? So we kind of have, when we do have an S1, I can see here. When we do have an S1, it's kind of lopping off, and then the heart is going into this type of arrhythmia. Sorry about that. So we have this lopping off, and then we're kind of going into these arrhythmias here. So we need some B4, we need that nerve conductivity. At least we're going to try and approach it that way. So this particular patient chewed 3 Cataplex B core, came back in 20 minutes and was regraphed. And this is what we found. So you can see the significant difference. So we have this beautiful S1 that came in. It's close to picture perfect. We even are starting to develop a really nice work to rest ratio. I'm certainly got a little bit of flutter in between there, but it's not too bad. So super, super impressive. And of course, this is temporary. She needs to continue to support this. But if we can get these kind of results in this short period of time, think about what we can do, you know, long-term with this kind of patient. And she was ecstatic. She said she felt completely different than she had in ages. So, you know, what a great testimony. What a great opportunity for us to make a difference in people's lives. So let's take a look at this particular graph. Now this one was scanned on 10/13 and then came back November 3rd. So this is a couple weeks later. So this particular person had 2 Cataplex B cords added to the protocol. Again, we're looking here at a very weak S1. So we don't have that strong musculature, and we here are completely missing our second sounds. So this person, by using, you know, the B core, was able to improve these S1s, return this tone, and inevitably these S2s came back. Sometimes it takes longer, sometimes it is quicker in the resolve, and it really just depends on the underlying issues. So some of that just comes with time and, you know, the learning this patient and what they really need. So it may be something that, for example, in Dr. Sobczak's office, he's open to muscle testing. So I may be supporting patients with supplements that I've muscle tested on their body. Maybe we're doing some herbal remedies that we can talk about. You know, for example, hawthorn berry is an absolutely beautiful herb. It's great to use as a cardiotonic and for arrhythmias. And we often have beautiful results by adding that in.
Let me
So,
just interject for a second and say
yeah.
that we've been doing Heart Sound Recorder here at the office for, I don't know, maybe 4 years or so, 4 or
Okay.
5 years.
Uh-huh.
And over that period of time, I can't think of one person that hasn't improved from one time to the next. I can't think of it. I mean, it may have happened once, but I certainly never heard about it.
Yeah, honestly, and well, first of all, your patients are so supported, and so kudos to you. And the patients are definitely open and love coming in and seeing their results. And one of your patients specifically, we did have quick results within 20 minutes of him chewing up 2 Cataplex B Core. He saw and I saw, and it's great when it's not only me, but they can really see on this graph, wow, look at the difference. I mean, sometimes it's so obvious, sometimes it's so intricate that it's just something that I'm picking up on, depending upon. But not only that, when he came back to see me, he said, I literally feel 20 years younger. And at that point, he had already recommended his wife come to see me and his brother. So she's now sitting in, and they're both coming together. So they call me the Heart Lady, and I love them. And we're doing some great things. So not only were we supporting his heart, he certainly had some digestive concerns going on. And we're getting to the bottom of those as well. So, it's great when you can look at so many different functions and help these people. So many people we talked about, they're either taking a multivitamin or some kind of B vitamin on a daily basis, very common supplements. Again, I try to, as Dr. Sobczak, reiterated, our bodies are designed to assimilate real food for growth and repair for the organs and tissues. And the chemistry that's in our nutrients, they're created specifically to be put together for specific organs and specific systems, so that we are feeding them to get this repair and regeneration. So, I specifically remember a gentleman who came in, and he was under functional medicine doctor's care, and he was on some amazing nutraceuticals. He knew a lot about his body, his endocrine system, how to support it, super fit. And I thought, gosh, what can I do for this guy? I was really excited to see his graph. I thought it's going to be, perfect. I really had to kind of keep poker face, because I was so surprised to see the static and the chaos. And it wasn't only just from one of the valves, it was throughout. So, again, I did the best I could to explain the philosophy and explain what we're doing and how we can support him. And we're slowly building, this trust relationship, because, when you're hearing things from functional medicine doctors and they're putting you on, these high potency nutraceuticals, I'm certainly not dispelling their magic either and what they can do for people, but I have to go with what I know and what I trust, certainly. So, he's coming to me for my art and for my science. So we're working on that. So let's see. Again, just wanted to kind of reiterate these beautiful foods that we see in our, not just our B supplements, but many of our supplements. It's interesting too, as we are in this, the pandemic, which hopefully my understanding has, by the death rate, has ended 2 months ago, but we're still having people test positive. And we certainly are seeing, post-neuralgia kind of symptoms for those people who were COVID positive. So I'm very interested, by implementing our Cataplex B Core, Dr. Sobczak, and exploring those possibilities of how we can support them and seeing if we can make some changes. So who knows, maybe that'll be our next webinar. But just speaking to some of the herbs and things also that we were referencing earlier, not only do we recommend this amazing nutrients from standard processed here in the States. We have a 20-year relationship with a company called MediHerb from Australia. So absolutely phenomenal sources where they farm their herbs, how they extract them, how they put them together, and of course the science behind each of them. And the industry there is very much regulated, similar to our pharmaceutical industry. So you know what's in that bottle is definitely in that bottle. Quality control is huge. So, and whether it's the root or the leaf or the whole plant that's to be included and effective, we know that to be the case by listening and utilizing these herbs in our programs. So something that I fully trust, which is also, why we get into what medications are you taking. We certainly want to make sure that we're compliant and that we're avoiding anything. If a patient were having high blood pressure issues, we may avoid things like licorice. And certainly, that's easy to do. We have a variety of herb offerings, but they certainly are very beneficial. When you can add things like ginkgo for circulation, people have air hunger when they're flying and they're getting that circulation or getting that blood and that oxygen to their brain, with one simple herb, because they are so potent and effective. I think that's absolutely fascinating. And these are constructed so that we have liquid forms as well as like tablet forms. So even if you don't have the best of digestive juices and acidity in the gut and able to digest some of these herbs, ours are actually created so that they break down and are absorbed and utilized just as easily as if it were a liquid. So I'm always fascinated when herbs are part of the program, and certainly we have some great ones to offer as well. I'm sure you see that, Dr. Sobczak.
Years ago, I was at a seminar and one of my colleagues was saying how he had a patient coming in who was depressed, and he had said, we need to get you on some St. John's wort. And she's like, well, I've already been on St. John's wort. It doesn't do anything for me. So what they did was they took one of her St. John's wort and they took one of the St. John's worts from MediHerb. They had them assayed, and it took 17 of the one that she was taking to equal one of the one from MediHerb, the active ingredient in it. So what you're getting from MediHerb, you're getting the active ingredient, you're getting the quality, you're not getting the stem or the bark or the garbage part of it that they say, oh, well, this is St. John's wort. You're actually getting good quality stuff. So it would have taken her 51 of the pills she was taking to get the same kind of response as 3 of them of the St. John's wort from MediHerb. So I always, relate that story because it blew me away.
That's awesome. And that's a great example. And it is so true. And, it just validates that, not all herbs and certainly of any nature are created equal, but MediHerb is far superior to most that I have seen on the market. And as you say, in your experience as well, they work. So it's the same thing with turmeric. The turmeric is 30 to 45% more bioavailable. So oftentimes people say, well, I'm taking a turmeric, I don't notice anything. Try ours, just give it a try. You're literally 1 or 2 a day can make a huge difference in your overall inflammation. That's such a great product too, because it's not conjugated in the liver and it goes through the gut, and the actual stock is taken off of the synergistic product with it, and the turmeric is able to get released into the bloodstream and cross that blood-brain barrier. So it's a fenugreek seed, it's what's combined with it. So it's actually kind of a cool combination. And I know there's a lot of companies trying to, add pepper and different things to try to create this bioavailability and absorbability of turmeric. But to me, it's second to none. And
well, the pepper products only last in your system about 30 minutes, whereas the turmeric from MediHerb will last in your system for about 3 hours.
There you go. There you go. So, which two, why you don't need as many.
And this turmeric is the only one from MediHerb that crosses the blood-brain barrier to reduce inflammation in your brain. So
That's right. That's right. Yeah, great results and for memory, people with dementia. And it's really rather benign. I mean, in terms of if, the older population tend to be on more medications. I mean, unless you're dealing with, some kind of blood thinner or whatnot. But otherwise, it's rather benign and can be mixed. So one of the websites, speaking of, just pharmaceuticals that I often suggest people take a look at, it's called Epocrates. So it's great for identifying, adverse reactions to pharmaceuticals, those interactions that could be detrimental, what level they would be at. So, it's just one of those that I trust, and it's a great go-to for pharmaceutical interaction.
you can get it as an app on your iPhone or your iPad. It's Epocrates, Epocrates. I use it regularly as well.
That's awesome. Yeah, for sure. So yeah, I mean, we certainly have a lot of great information, a lot of sources, and places to send people for information. Certainly one of my favorites, also the Weston Price Foundation. Wow, what science behind the literature they put out and the information. You could just spend days kind of scouring that website. So that is the Weston Price Foundation. And Nourishing Traditions is that great cookbook by Sally Fallon. Everybody should have that in their home. Talking about the heart, the cholesterol myth, that there's a great book out there by Dr. Radskoff. He's talking about patients who are taking statins or considering going on one. This is kind of one of those must reads. A lot of information out there about fats, why fats are actually healthy for you. The heart needs fat for its energy. Our brain needs fat. 60% of the capacity is made of DHA in our brain. So we need that fat for the protection of our cell membranes. So, we have so much information and knowledge that we can share with patients. And like you, seeing people regularly, we can get a little deeper with them as time goes on. So certainly don't want to throw it all at them right at once, but we certainly have plenty to keep them motivated. So anything else? I want to just say thank you so much, everybody, for your time and attention tonight. And I'm sure that you know of family or friend who could potentially, benefit from this kind of service, the Heart Sound Recorder, and we would love to serve you. So you can call Dr. Sobczak's office, speak with Nicole or whomever, and they do the scheduling there. Again, I come in twice a month, so I'm happy to serve each and every one of you. And I hope you
guys, it's within your budget. It's only $20 for the scan. I mean, it's not expensive. I mean, where are you going to get your heart evaluated for $20? Seriously? So, we make it affordable so that it's something that you can do. And I get mine checked like every 3 or 4 months just to make sure I'm doing well. If anybody has any questions, you can type them in the chat box and we'll be happy to answer them for you.
Sure, for sure.
So, but anyways, I appreciate you coming on here, Lynn. That was a great presentation. Hopefully everybody enjoyed it and learned a lot. I'm making sure nobody put anything in the question and answer section.
Sure.
And let's see, chats. Okay, so I'm not seeing anybody having any questions right now.
Okay.
Oh, there we go. Teresa says, if you have the mother gene, will Cataplex B work for them? Okay, I know what you're talking about. Go ahead.
The MTHFR.
Yeah, MTHFR.
Sure. So yes. So these patients have the inability to convert folic acid into an activated form. So we certainly support the DNA that they do have by using something like Cataplex B-Core that has true folate in it. So we also support the liver because it is responsible for this conversion. So it may be that we're adding things like beta food. I may be doing some Vitanox, which really helps to support the DNA so that we're showing positive effects from what we have in our gene expression. So yes, over time, we just approach it a little bit differently than recommending the synthetic form of a methylated folate, even though, there are people who certainly feel like they're benefited from that. There's a lot of people too that have side effects. So you got to be real careful with how, that is balanced. Can't be too high, can't be too low. So, there's a lot of adjusting that goes on. But to answer your question, absolutely, we support those people. And sometimes it's that we're supporting them so they are gently and possibly working with their physician, or if they put themselves on the methylated B, they're lowering their dosage of methylated B as we go along. So, absolutely, we can support them. Great question. Thank you.
Anybody else have any questions? Well, does high lipoprotein levels factor in?
Yeah, and maybe this is a great time, Dr. Sobczak, that we can actually talk about some of those labs values that people can bring in.
Right.
And we can certainly evaluate those. And we have, let's see, I have one handy here. We have this excellent omega-3 plus. It's a test that we're doing from Standard Process. So this is very evaluative of the cell membrane and the DHA and the EPA. We're looking at trans fat from this. So instead of looking at those cholesterol, and yes, lipoprotein can also be part of that panel, we often would recommend somebody get, and this is like, what are you charging, Dr.?
It's $50.
Yeah, $50. So, this is great. It's a finger stick, and you take it home, you send it in, we get the results 2 weeks later. Either Dr. Sobczak or myself can go over that with the patient. So between this and the results from your labs, we certainly have a quality analysis of how we can recommend supplementation. Thank you for the question.
Anyone else? Interestingly, while I'm just checking to see, Dr. Royal Lee, who was the founder, I guess you would say, of Standard Process, he was also he was a dentist actually, and
right.
As from Weston Price Foundation, he was friends with Weston Price, but he was a dentist, and he was also an engineer. It's called Lee Engineering, and he developed the radar so that they could drop bombs in World War II. They said they could drop 30,000 feet into a pickle jar. Before that, they used to just drop them wherever. But he was this genius, and he actually devised Catalin in order to try to help his mother who had cancer, and she got better. He said this would be the only supplement anyone would ever need to take, and we carry Catalin. It's a multivitamin, but the problem is that with all of the processed foods and everything out there, it just, our bodies are so depleted now that it just, Catalin in and of itself is not enough anymore.
That's so true. Yeah, and I've read and been trained that eventually Catalin will take care of all systems, and certainly it will. But again, like you say, we have so many layers and we're so depleted, and we need those minerals and those coenzymes and those factors that, Catalin is a great foundational product for sure for most patients. So sometimes we can't even get to the Catalin because we have other things that are so primary. And maybe over time, we can add it in depending upon what the patient's protocol is. But yeah, he was a very compassionate man. I understood too that one of his best friends was an alcoholic, and he was determined to help him and support him and get him through, that addiction. And so I'm often wondering, with the Hepatoplex B and the G's, if, helping that body process that kind of thing, if that was, kind of the catalyst to him creating that. So I just can't imagine what used to go through his mind at night, what a brilliant man and full of knowledge. And aren't we so grateful and blessed to have this today? I thank God all the time. It brings me energy. It brings me life, that I've been able to support, surely my family, my friends, and people everywhere with this supplement. So I used to live in Wisconsin, so it's my home state. So I didn't mention that before, but that's where I got my starts and how I learned nutrition response testing, working with a practitioner there. And so if you ever get an opportunity, I'm sure you've been there, Dr. Sobczak, to
I've
tour.
been there. It's wonderful.
Yeah. Oh, it's incredible. Yeah, right. I think they're going to start up tours again in 2021, but it's certainly worth the journey. If you ever make it to, that part of Wisconsin, you won't forget it, and it'll seal your deal. So.
Well, I want to thank you for coming tonight and talking. I want to thank everyone who has been on the webinar tonight, and those of you who are watching it afterwards, who couldn't make it. And so I guess at this, I'd just like to say I appreciate you, Lynn. I appreciate all of you who are watching. Our goal here is to, our purpose here is to help people to enhance their lives, to change their lives. So, that's what we're here for. And, all I'm going to say is, God bless, and we'll see you on the next one.
God bless everyone's heart for sure.
All righty. You guys all take care. Thanks
You
again,
too.
Lynn.
Thank you, Dr. Sobczak. Okay.
We'll see you all soon.
We'll see you next Friday.
All righty. Yeah, the 18th of December is when she'll be in. So
Absolutely.
thanks again, guys.
Until then, bye-bye.
Bye-bye.